Welcome to Plastic Surgery TNA. In today's episode, we're going to focus on the guys and we're going to talk about aesthetic surgery for men. And yes, men get aesthetic surgery. And I want to talk about one thing that's really sensitive to a man's psyche, his physique, his overall well-being, and that's his chest. So today's episode, we're going to talk about gynecomastia, which is basically affectionately called man boobs. I am Earl Stephenson Jr., your Atlanta board certified plastic surgeon with nearly 20 years of experience here in Atlanta. And if you've never seen me before and never joined this podcast, welcome. I really appreciate it. For those returning, thank you so much. For both returning and new viewers, if you like, share. If you like, subscribe. I really would appreciate it. It will help me grow my channel. I can do bigger and better things. So with that out of the way, I would like to take a minute or more than a minute to really focus in on the guys. And I want you ladies to listen to, because you may have a guy in your life. It may be your plus one. It may be your brother. It may be your uncle. It may be your dad. Someone really close to you, a lifelong friend. Men suffer from body issues. They really suffer from contour issues of their body, whether they have a beer belly or love handles. They really don't like that and really would like to be in shape. But I don't think anything affects a man more than his chest. We've all seen it. And this is an extreme example, but you'll get what I'm saying. It's a hot summer day. You're out as a guy with your girlfriend, your wife, your family, and you're at the pool. And everybody's in their swimwear and they're having a great time. And they ask you to get in, or you get in, and you get in with your shirt on. Now, you're in the pool with all your clothes on. You feel kind of ridiculous. But you know why, ladies, or people who do not suffer from this, why this guy is in the pool with his shirt on? Because he's embarrassed. He's embarrassed to take off his shirt because he suffers from gynecomastia. And most women will tell you, oh, it doesn't matter. It's fine. I like the dad bod. But it really messes with a guy's head. And if they could get it squared away where they have a chest that's more sculpted, more masculine, it will help them immensely. So gynecomastia is a real thing. Just like when women have children and have stretch marks and the saggy skin from their tummy, that really affects their psyche, their self-image. No different. Guys who have a more feminine chest, it affects them tremendously. So I really want to zone in and hone in on a couple of things today. I want to talk about the types of gynecomastia, because there are different types, the way you treat gynecomastia. We'll touch a bit on the cost, and we'll touch a bit on the recovery from the type of procedures that you would need to sculpt or reshape your chest. So again, gynecomastia is a big problem in the male community, and it's underappreciated outside of the community, and it's seldom talked about even within the community. So I'm really here to kind of shed some light on this subject, because sometimes people don't know. Men don't know. Women don't know. So I want everybody to be informed, and I want men who may suffer from this to know that there are options. So let's kick it off. So what causes this? Or better yet, what is it? Gynecomastia is a collection of excess glandular or breast tissue. Yes, men have breast tissue and men can have breast cancer, albeit rare, than women. Men have breast tissue, and that breast tissue can be affected by disease processes or medicines. So, gynecomastia is not a cancerous problem per se, but it's a problem of overabundance of the breast tissue, fat, and skin in any combination. As we are born as young men, babies, newborns, we have rolls of fat everywhere. We have fat on our chest, and it's cute and affectionate, and everybody loves it. And it kind of looks like breast, but no one makes a big deal of it because it's a soft, roly poly baby. But that effect of small breast on a newborn is really from maternal estrogen. And as that maternal estrogen dissipates or disappears, then as the baby gets a little bit older, then that is not an issue. So that's not something to be worried or concerned about. As that baby boy heads into the preteen era, then again, you can have fullness of the chest that mimics a female breast, and you might want to be a little bit aware that this could be abnormal, especially if it's persistent. It can represent potentially, but not always, a problem with a tumor or a cancer that produces estrogen. And that can usually be in the genital region primarily. And if this is of a concern, then as parents or the mom, an evaluation by the pediatrician will help kind of readily determine where we are. As we move through to teens, puberty plays a big part of this. So fluctuating hormones as teenagers turn into young men, that can cause some changes in the chest and mimicking breast tissue, but this should readily dissipate over time within 6 months at the earliest, but it can last up into 2 years. Again, if this is persistent or one chest or one breast looks bigger than the other, this may also represent a sign from a estrogen producing tumor in the genital area, typically. So again, it warrants evaluation by a primary care physician or a pediatrician to make sure that that's not an issue. As teens move into young adulthood, then the floodgates open. Once they've gotten out of puberty, typically they're lean and masculine as far as their chest, and you don't really have this issue. But this issue can be caused by behaviors. It can be caused by medications for other medical problems. So again, one needs to be aware as a parent and even as a primary care physician or a plastic and reconstructive surgeon. So for adults, you can have terrible diseases of alcoholism, like cirrhosis of the liver. You can have cancers of the liver, cancers of the lung, cancers of the adrenal glands, which sit on top of the kidneys, cancer, again, of the gonadal tissue. You got to be aware of that. You can have medications for what you think would be very routine or innocuous. You got a stomach ulcer, you take Zantac. Zantac can potentially produce breast-like tissue. You can have adult men taking steroids for medical conditions or weightlifting issues where they're trying to build bulk. So steroids can be a potential medication that can cause increased breast mass, increased skin and or fat of the male chest. You can also have anti-anxiety medications such as Valium. It has a potential to cause this, but antipsychotic medications such as risperidone have been known to produce gynecomastia, or male breast tissue in an overabundance. So again, as a adult male, you may want to run through these things. You check with your primary care physician. He or she checks you out. Hopefully you have none of these things, and it leads you to the plastic surgeon who, if you are concerned, can help you with remedies about this. If you go to your primary care physician and they find one of these things, then it can be readily taken care of by changing of medications, identifying, hopefully you don't have cancer, identifying cancers and getting them treated. So it's really important that, yes, this is a cosmetic issue, but it can have some medical ramifications, and those medical potential problems need to be cleared off the board before you go forward if this is bothersome to you from a cosmetic standpoint. And to that end, you've done all your research, you've seen your physician, you are in completely great health, and this is an issue that is cosmetic. No matter what, it still can be damaging. There are many studies that point to gynecomastia relating to increased rates of depression due to poor body image, increased rates of anxiety due to poor body image. So, yes, you may not have a medical problem, and you may think, well, great, but am I being vain? Am I being too over the top? Am I doing too much? No, if it plays into a negative self-image, mental health is just as well as physical health. They're all connected. So if this is something that's taxing to you mentally, then you want to seek answers for your potential issue. And that's when you see somebody like me, plastic surgeon who specializes and knows how to contour a man's chest so that it makes him look more masculine and improves his self-image. So after we've kind of covered that, I want to really jump into the types or the presentations of gynecomastia. And they're basically, in my mind, 4 types. There's type 1, obviously, type 2, type 3, and type 4. And they are all kind of nuances of how big the breast gland is, how much excess tissue there may or skin there may be, how much fat, how much droop. So those are the factors that come into play when you talk about the types, and we'll give examples of each type and even some surgical treatments before and after, and a couple of in-surgery shots just to kind of give you some perspective. If you have a queasy stomach, I'll do my best to kind of let you know what's coming up before, so you can either turn away or kind of handle it the best way you can. So with that being said, let's jump into type 1 gynecomastia. Okay, let's talk about type 1 gynecomastia. So let's get this picture down and let's bring this image up of a real patient. So bam, we got this up. And a lot of you are going, wait a minute. Wait, I don't see anything wrong. This is perfectly normal. This guy's in great shape. He should be willing and ready to take his shirt off in the appropriate manner at any time, day or night. And you're not wrong. I mean, it's really, really not a problem for us, but it is a problem for him. And this is type 1 gynecomastia, or type 1 gyno. That's what we'll call it. It's really a slight excess of the breast tissue just beneath the areola. So it produces a little bud underneath the areola. And I think it's not really appreciated. Definitely, you can see it's not appreciated in this front view of this patient. He looks perfectly fine. So let's flip this to the side and let's take a look at a side view. And I think you can get a better appreciation. And some of you may still say, this is not an issue. But again, it's an issue for him. It affects his well-being. and it's something that can be corrected. So the nipple has a little bit of a triangular shape as opposed to being flat on the chest muscle. This is what bothers him. This is typically the type of gynecomastia, albeit extremely mild, that can affect bodybuilders. And so bodybuilders are really ripped, sculpted, in great shape, but they have this a little bit of over exuberance of the glandular tissue that gives them this little puffy nipple. And that's what they usually call it, a little puffy nipple that really affects their well-being. And it allows them as they, or when they wear shirts, doesn't allow them. When they wear shirts, you can just get a hint of seeing a nipple. Again, that doesn't really make a man feel good. And women, you can certainly appreciate that. That doesn't make you feel good per se. So even though he's in great shape, he still has an issue that he wants to have addressed. So again, what I would do in this particular instance, and what I did, and we don't have the pictures for him before and after, but this can be performed in the office if you wanted to, because we're going to address just one of the three areas that I talked about earlier that can be affected. It's just a gland. There's really no excess tissue and no excess fat and no excess skin. So we're going to take care of the breast tissue. So what I would do is at the base of this areola, just on the bottom side, within the brown part, make a little incision in a smiley face type of orientation, with him either numbed up, of course, and always with Novocaine or lidocaine, either completely awake because it's a very small procedure, or with a little bit of sedation by mouth, a little bit of Versed, a little bit of Valium, a little bit of Phenergan for nausea. Those things in combination can help him relax, not put him to sleep, but make him more relaxed and allow us to do that in combination with local anesthetic. Or if he chooses that he doesn't want to be aware of anything, obviously we can, do this procedure under general anesthetic as easily as well. So again, same procedure. We would just numb up that area. I would make a smiley face incision within the brown part of the areola at the base, and then I would get below the skin of the nipple, and then I would outline and find the gland, and I would take the gland out on each side, so that when that is stitched back together, that nipple is not puffy and it lies flat against that pectoralis major muscle, which is a fancy word for the pec muscle, that gives him a more masculine look in and out of clothing. So that is type 1 gyno, where we just have a little increase in the breast tissue itself underneath the areola, and that can be easily treated in the office, local anesthetic plus or minus some type of sedation, or it can also and always be treated with general anesthetic. So type 1 gynecomastia. So now let's roll into type 2 gynecomastia. All right, we're going to move on to type 2 gyno, and this is a variation on type 1. In type 1, we saw there was just a little increase in the gland just below the areola, giving it a little puffy nipple, a little bit of a tint or a triangular nipple. Now we've got a little bit more breast tissue and maybe a little component of fat, giving just an overall fullness to the chest. And so let's look at type 2 gyno. Let's bring up this patient. Again, I think most people would say, there's nothing wrong with this. This is something that can be, easily ignored, I guess, for lack of a better term. You can just get on with your life and move on. But again, this affected this patient terribly. He even went to another surgeon, a general surgeon. As you can see, these kind of horizontal marks above the top of the nipple that tried to do some type of surgery to reduce this. and left him with a horrible scar in a sense that it's just poorly placed. It's not too bad as far as healing, just poor placement and obvious scar. But nonetheless, this patient has asymmetric or uneven fullness to his chest. It causes him embarrassment when he wears certain clothes. It will not allow him, or he will not allow himself to wear certain clothes. And he may or may not take off his shirt at various points where it's something that's reasonable at the beach, uh, in front of his significant other, doing intimate sessions, what have you. He just doesn't feel good about it. So, as you can see on our right of the screen, that breast, for lack of a better term, it's got a little roundness, a little fullness. Not bad, but it does have a little roundness to it. On the left of the screen, it has a little more fullness and a little bit more droop. As you can see, the nipple level is uneven. So it has a little excess skin, not a ton. It definitely has more breast tissue than normal or average, and it probably has a bit of fat as well. So in this case, unlike the first case where we just removed the breast tissue and not any fat, not any skin, we're going to have to remove some breast tissue and some fat. The skin, after that type of treatment, will shrink back. Excuse me, shrink back. That was just bad. So let me have a drink of water. We'll shrink back. And so what I proposed for this particular patient was that we would perform liposuction of his chest. And that's the area that you see. I would go a little bit below the crease of the breast so that I can break up that crease so I can get that skin to lay a little bit flatter and not want to form a crease. And then also a little smiley face incision in the dark part at the bottom of his areola so that we can take out any excess glandular tissue, because a lot of times you'll see gyno treatment where it's just liposuction, and that's fine. But in my experience, and when I was younger, I would just used to do that and not really address the gland. And my clients would come back and say, well, it's better, but it's still puffy underneath my nipple. So I found very readily that you need to combine liposuction of the excess fat of the chest, kind of the lateral chest going toward the armpit and below the crease to kind of flatten that skin out. And you also need to treat the glands so that that skin, that nipple lay as flat as possible on that chest muscle. So that's what clients want. So we did just that. We liposuction, we took out the gland, and got this result. Let's see here. Let's take this down and let's bring that up. So we got this result. I think it's okay result. It's an older result. This was a while back. He's definitely flatter. He still has a little bit more volume on his left side, and there's nothing I really can do about the nipple level. That's what it is, and I'm not going to put any additional scars on his chest to even that out. That just doesn't make sense. But it's a little fuller still, and we probably could have evacuated or removed a little bit more fat in that scenario. But definitely flatter, and he definitely felt more comfortable in clothing and out of clothing with this result. You can see that you can't see the incision in the areola. And then we use small, very small incisions, probably about the distance between my fingers for the liposuction access so that we can suction the fat. So no big scars like you see the first surgeon's attempt where you have those big lines above his nipple. So none of that. So again, better. Could it have been better in my opinion? Probably. But, again, early on in my career, this is kind of where we are, and I've advanced tremendously from this point. And so I think it's a really good result. And modern techniques, modern technologies with the advent of vaser liposuction, which kind of helps shrink the skin and melt the fat in certain situations where that can be useful to help contour. So there have been advances in technology that can help us get better results. So let's look at it side by side. for comparison. So it's kind of hard to see or hard to realize what's before and what's after when you look at it individually. So this is what we have. Again, to the left of the screen or closer to me, you've got the before, and you can see now, you can kind of appreciate that he does have some fullness that looks like a small A-cup breast. I think everybody now can appreciate that with some points of reference as to the after picture, where he looks a lot flatter. Again, I think I could have removed a little bit more tissue on the lateral aspect or going toward the armpit. There may still be a little bit of swelling there. There's probably less than 3 months from healing, so definitely improvement there. But he was thrilled, and he felt comfortable, and he was, again, thrilled with his results. So this is type 2 gyno, where we have, again, increased gland tissue, increased fat, not necessarily increased skin. So we don't really treat the skin. We let the liposuction really help the skin shrink back, and redrape. So I would say type 2, along with type 4 nowadays, is probably the most common types that I see. And you'll understand why as we move forward. Let's look at another type 2 case. Again, from the front, you're like, this guy is rock solid. He's good. He doesn't have really a breast shape like an A-cup breast, but he was not happy, and he was a really thin guy. And from this front view, it's hard to really make an argument that something needs to be done. You're probably going, what's wrong with this dude? But that's why you examine, you touch, you feel, you get different vantage points. And from the 3/4 view, you can see he has a little bit of a rounding of his chest, a little bit of an A-cup type breast. And so, again, he's not comfortable with that. He's not comfortable with that. And there are measures to improve that. So that's a decision he makes. You may not make the same decision, but this is a decision that he made. And there are treatments out there to help him. So this is the 3/4 before. We saw the frontal view, which really you really can't appreciate it. But let's look at the after pictures or the results. So let's pull this up, and I apologize for the exposure on these. This is after. And there you're going, hey, it's flat. It's hard for me to remember what the first one looked like, but it's flat. That's fine. No problem. I think where you're going to see the result is on the 3/4 view. If you remember, it was kind of rounded. Again, really rounded on the 3/4 view, and now it's flat. That areola, the dark part, is really flat up against that muscle. And I'm going to take this down, and I'm going to bring the 3/4 before up. That's before. You can see that it's round, and it looks a little bit, you can kind of convince yourself it looks a little bit like an A-cup breast, as opposed to after, when it's really flat. So he was ecstatic, and this is the results that we get currently, with my clients, and that's what we're looking for. So again, in this gyno type 2, liposuction with removal of the breast gland is the go-to procedure for me, and has gotten my clients, exceptional results. Now, we talked about type 1. We talked about type 2. Let's jump briefly into type 3, because type 3 is kind of the redheaded stepchild. It's a little bit of a mix between the type 2 and a little bit of mix between the type 4. And let me show you what I mean. And I don't really see a lot of these. And it's hard for plastic surgeons to make a decision for which treatment would be the best. And I'll try to explain that. So let's take this down, and let's bring this up. So this is what I would call a type 3. He's got excess breast tissue. He definitely has excess fat, and he has a little excess skin, because you now see more of what you would think would be a breast. It's rounder. It's got some volume. It doesn't have a lot of loose skin, but the skin is loose. So what does that really mean? For me, if I treat it with liposuction and removal of the gland, I'm really counting on the resiliency and the tautness and the elasticity of the skin to really bounce back and stick to that core. In him, I can't really say that I'm 100% certain that that's going to do that because it's loose. And again, this is where physical exam trumps pictures every time. You can kind of tell the quality. It's loose. It's a little, I don't know how to explain. It's just very loose, easily movable. And I'm not real confident that that skin will retract back in a smooth pattern. Now, it's going to retract back. It may be very wrinkly because it's got a lot of excess skin, and that skin may not smooth out evenly. So in this particular case, and let's look at the 3/4 view while I'm talking, I wasn't really sold that I can just get the result that I wanted with the traditional methods of liposuction and gland excision with a little smiley face incision in the areola. So I opted for this particular client to do what we call the fancy $1 million word is a subcutaneous mastectomy, where I basically took out the excess skin, nipple, areolar, fat in one kind of fell swoop. It looks like a little football removal of all that tissue, sewed the ends together, and did a free nipple graft. Took the nipple off the tissue that I removed and placed it back where it should be on a male chest, which is in a different location than a female chest. In a male chest, and we'll talk about this more in type 4, that nipple needs to be a little off center out toward the armpit, just a little bit, and it needs to be smaller, about the size of maybe a quarter, as opposed to a woman's areola, which is maybe dead center, and in various sizes, but fairly large, but various sizes. So we opted to remove it kind of in one mass and then put the incision down where the natural crease would be, and then grafted the nipple in the areola in the best position for a man. So class 3 or type 3 gyno can be treated that way, or one may opt to just do liposuction and gland removal. But if that is done, it must be communicated to the patient that they could have some wrinkling of the skin as the skin kind of retracts, because it may not retract smoothly and evenly, and that may need to be addressed in another procedure. So you just have to let clients know what the potential outcomes would be of the traditional liposuction with gland incision or a subcutaneous mastectomy, and help guide them to what they would feel would be right for them and get the result that they want. So this is gyno type 3. It's a tweener, in my opinion. A little loose skin, looser than most, but not as loose as, excessive skin. Skin doesn't retract really evenly. There's a lot of fullness because of breast tissue and fat. So again, it's a tweener. So let's look at type 4 next. Okay, we're coming down to the home stretch. We're going to talk about gyno type 4, gynecomastia type 4, where you have an excess of all the components. You have an excess of breast tissue, you have an excess of skin, you have an excess of fat, and you've just got what is shaping up to be a woman's breast. And so let's look at an example. This is a picture of a patient that I performed an operation on. And so it has some markings on them, so try to ignore those, and we're not going to go into that today. That's beyond what we want to do. So let's bring this up, and let's just look at the anatomy. You have fullness of this person's this man's chest. He's got excess fat. He's got excess skin. One side's a little bit uneven versus the other. He's got droop to his, nipple, more severe than one of the earlier cases we saw. And there's really no way that you can just liposuction or remove the fat and hope that or count on that skin retracting back smoothly, because it's just too much of it. When you liposuction, you just basically empty the skin and make it thinner. And the more you have to empty, it means the more skin you have, and the less likely that's to retract back smoothly. So there's just no way that that's going to happen. So in that case, you need to remove the excess tissue in one piece. That's the excess skin, the nipple and areola itself, and the excess fat and breast tissue. Now, there have been versions of this, and I've seen this in literature. I've seen this in real life from patients, men who've had this done elsewhere, where they get a breast reduction. And this is what it really is. This is a male breast reduction, in the same way that a woman would get her breasts reduced. It's this upside down T, it's this anchor type incision. And for a woman, that's fine. You can have that because you're not making them flat. You're leaving them with some breast tissue that can hide the scars. The scar around the areola is kind of well hidden and smaller. The scar between the areola and the crease can be a little bit visible, but women have a little bit of droop, and that can be somewhat hidden. The scar in the crease is hidden because it's hidden again by the fullness of the breast and a little bit of droop that's natural. In a man that you're flattening, you've got this big T on their chest below their nipple, and that's not cosmetic. That's not aesthetic, no matter how flat you got them. So you just cannot. It is a novice, in my opinion, that will make that incision. You have to do, in my opinion, a subcutaneous mastectomy, which is the $1 million word, where you take out all the tissue in one fell swoop on each side. That's breast, fat, skin, and nipple. And then you replant the nipple in the right position for a man. And so the incision is one. It just ends up in the crease, the natural crease between the chest and upper tummy or abdomen, and that's natural. It looks natural. It can be even tattooed a little bit, so it's natural, and that works better. It's one incision that's aligned versus an anchor that's very well tolerated. The line incision is very well tolerated. So that's what I did for this gentleman. So we'll take that down. Now I'll put up my warning. I told you I was going to do this for people who are a little bit squeamish. This may be a little bit too much for you, so you can fast forward. You can get to the next, little section or node in this podcast, but you can shimmy past it, or you can just, if you like it, this type of stuff, here we go. I'm just warning you so you have a chance to make your decision. So here we go. And it's not too bad. So I just wanted to give you some perspective. If we look closely, it's a little bit of a long shot, but if you look closely on the left side of the screen, you can see that chest, you're looking, let me give you some orientation. You're looking at the patient laying down. As you're looking toward that blue screen, that's where the head is, and the feet are closer to where you would be here. So you're looking at his chest. On the left side of the screen, you can see that you can barely see the chest, is what you want in a man. And on the right side of the screen, you see this fullness of his chest. So we've treated the patient's left side for all intensive purposes on the screen and not gotten to the right side as of yet. But you can see the difference that this surgery makes right on the table. It's pretty immediate. So after healing, this is going to be a great result, and the patient should be happy. So I wanted to kind of give you that perspective. Now, this is kind of what we take out. Again, one last time, I'm going to put this up. So turn away, do what you need to do. But here we go. I'm going to show you the breast tissue that actually came out of this particular patient. And it's different from each side. It doesn't have to be even. We're going for contour, not measurements having the same amount. We're going for what it looks like. So this is breast tissue. This is what we got. We got breast tissue on the right with some lipo. We just did lipo, which wrote that down. But this is the breast tissue that came out on the right and that came out on the left. So that needs to be removed. Liposuction can't really sometimes effectively remove that, and it needs to be directly removed. So that's a decision that your surgeon will make either beforehand, in surgery, but that needs to be addressed thoroughly. So that was removed, and we basically then stitched things back up and took the nipple off of the skin that we removed and placed it back. And I'm just going to give you a little bit of a sense of how that's done. This is a different patient, but the same technique was employed. So let's look at that. Again, last time, graphic warning for those a little bit squeamish. And here we go. So same concept as the first gentleman. I took off that tissue in one fell swoop, and it produces a scar right at the kind of the normal crease line, if you will, rather. And I'm using kind of a syringe or the back of syringe to kind of gauge my nipple and areola. And you can see it's a little off center, as it should be in the male, and it's smaller, and that's the size of it. So I will take his nipple and areola that we removed initially and size it down and stitch it to that area and let it heal. And that's the incision right there. Yes, it's long, but it's natural and it's aesthetic. And he'll be able to tolerate that just with no shirt on. And I don't think anybody would really blink an eye. He will be comfortable with that, as opposed to what I've seen, which I think is hideous, an inverted T like you would perform on a lady, which is not well tolerated from an aesthetic standpoint. So that's how I take care of people who have gyno type 4. You've got to be aggressive with it. You can't short sheet it with liposuction and messing with the gland. You just got to take that excess tissue off. The client's going to have to accept an incision that's well placed from an aesthetic standpoint and treat it well so that it heals well to give them the great contour that they want. So again, this has been a little bit of a talk about man boobs and male breast reduction. Let's just get down to it. And the fancy words are gynecomastia, liposuction with gland excision, or a subcutaneous mastectomy with full or free nipple grafting. Those are the $1 million words. But if this is something that resonates with you, it resonates with a loved one, and you just want information, hopefully you'll share this video. You'll subscribe to this channel for information like this and more. It'll be helpful. And, I would really appreciate that, because it would help my channel grow, and I can present bigger and better things. I can have people come on more regularly. We can get some sponsors, and I can show you some equipment, and there are all kinds of things we can do with a larger viewing audience. So I would really appreciate that if you would subscribe, or at least share this video, especially this one. I'll say this, any of them that resonate with somebody that you know. It may be yourself, or it may be somebody that you are close to. If you're ready to at least have a conversation, and it doesn't cost you anything great to have a conversation with me, then I just ask you to do something really simple. You just call my office and we can set up a conversation. You dial the number on the screen. I almost knocked the mic over, but you dial the number on the screen. We'll be happy to set up an appointment with you. I'm not double booking myself. You don't have to wait in the waiting room like you're waiting at a bus stop. We have a boutique practice where we talk to people who are interested in talking to us. So we are able to take our time, sit down for an hour 15 minutes, hour 30 minutes, whatever it takes within that time frame to get you the answers that you want so that you can make the decision you want. Doesn't mean you're going to have surgery. It may not even mean you have surgery with me, but you get good, honest information. So that's what you can do if you want to work with me, because I would love to work with you. If you are viewing outside of the, I guess, the throes of Atlanta, and that you want to have this done and you don't really know where to start, I've got a couple of things that you can do to kind of help you along that process. First, I would ask you to go to the American Board of Plastic Surgery. It's simply dial it up on the web, type in the surgeons, maybe even your geographic area, or you've had a couple of surgeons that you want to know about or that you know about, and you want to type in their information to see if they're board certified. That's the first thing to do. So I would definitely jump on the web and go to the website for the American Board of Plastic Surgery. You can also go to your local medical society in your state, type in the particular plastic surgeon's name. You can see that they're certified, that their license is active, and if they even have any complaints against them. That would be definitely good. Always try to find clients that can tell you their story, having been through the process of wherever you decide to go. That will help you. Reviews are great. Google reviews are great. Talking to people directly is even better if you can. So it's really important. Men, I think, get kind of pushed to the side for many things, and we can talk about other things. But men are important too. Men are not just supposed to just pay bills and die. They want to feel good about themselves. They want to have fun. They want to be present for the people in their lives. And sometimes when you have issues like this of body contour, it's hard to be present. So with that being said, I hope this has been helpful. Share, subscribe, and I really thank you for your time. And we'll see you next Saturday at 11 a.m. Eastern time. Until then, peace.